After almost 60 years of strong bipartisan support, Congress has cut all federal funding for public media, stripping away a critical pillar of support for local stations like ours. At Vermont Public, we'll lose at least $2 million this year. If all our sustaining members increase their gift by $7 per month, we'll close that gap for good. Increase your gift today and help close the gap at vermontpublic.org/update.
From Vermont Public, this is The Frequency. I'm Mary Engish. It's Monday, September 22nd, and here are today's headlines. There's a model to tackle overlapping problems like crime, addiction, and homelessness, and it's gaining popularity in some Vermont towns. It's called the Situation Table, and it involves law enforcement and social services agencies holding weekly meetings in their communities. The goal, to develop ways to help people struggling with complex issues. So far, 8 municipalities in Vermont have adopted the model. The Department of Public Safety used a federal grant to pay for training in those towns. Commissioner Jennifer Morrison says the approach struck her as, quote, very Vermont-y.
When you think about how to get help to our most vulnerable, it really does compel us to share information and lift people up and wrap services around them in a holistic way rather than doing things in a silos.
Morrison said they don't have the money to sponsor training for any additional towns right now, but she says they are looking into changing that. Health officials in Vermont are committing to preserve vaccine access in the state. They gathered with doctors on Friday for a press briefing. It came as a key federal panel met in Atlanta to review the country's vaccine schedule. U.S. Health Secretary Robert F. Kennedy Jr. recently filled that panel with all new members, including several known vaccine skeptics. Rebecca Bell is a pediatric critical care doctor at UVM's Children's Hospital. She says she and her peers are anxious that childhood vaccines may be under threat at the federal level.
We are worried about, the tone and the misinformation that is coming out of, bodies like the ACIP, information coming out from the HHS secretary.
Federal regulators recently narrowed eligibility for COVID-19 vaccines. This week, the Vermont Department of Health issued a standing order expanding access to those shots at pharmacies in response. A St Johnsbury cop who was shot and wounded last December will not face any charges for firing his own gun at the man accused of attacking him. As Vermont Public's Liam Elder-Connors reports, the Attorney General's office determined the use of force was justified.
The incident began on December 13, 2024, when Captain Jason Gray was investigating a domestic assault report at the home of Scott Mason. Law enforcement officials say Mason shot Gray twice during the incident. Gray shot at Mason but didn't hit him. Gray was hospitalized and treated for, quote, extensive but non-fatal injuries, according to the Attorney General's office. Vermont law allows police to use deadly force if they're facing an imminent threat of death or serious bodily injury and if there's no other alternative. Mason has pleaded not guilty to several charges related to the shooting. They include first-degree attempted murder and aggravated assault on a law enforcement officer. For Vermont Public, I'm Liam Elder-Connors.
Vermont state officials and healthcare leaders are working together to apply for new federal grant money. The funds would bolster the state's struggling healthcare system. The One Big Beautiful Bill Act established the new $50 billion Rural Health Transformation Fund. States have a narrow window to apply for money to address specific rural health challenges. Owen Foster chairs the Green Mountain Care Board. He recently told Vermont Edition the state could unlock $100 million for the first 5 years.
And then you can apply for a second tranche of money on top of that $100 million if you have an approved application. So there is an opportunity to try and bring in some funds to create some of more of the access and sustainability we want at lower cost, efficient providers that improve population health.
Funding decisions will be made by the end of this year. There's a new addition to Rutland's Sculpture Trail. And Vermont Public's Nina Keck reports the statue unveiled Friday honors a Rutland doctor who identified the first polio epidemic in the country.
Dr. Charles Caverly had been in practice barely 10 years when he identified an outbreak of polio in the Rutland area in the summer of 1894. At the time, sporadic cases of paralysis and related symptoms had been noted in the U.S. and Europe, but they weren't typically connected to polio, and the illness wasn't thought to be contagious. That changed after Caverly did extensive research on the 123 cases reported in Vermont as head of the State Board of Health. Health experts say Caverly's research laid the groundwork for later understanding and treatment of polio. Italian sculptor Alessandro Lombardo created the marble statue of Caverly that's now part of the Rutland Trail. It stands at the corner of West and Church Streets in Rutland. The statue also pays tribute to the hundreds of local medical professionals who responded to the COVID-19 pandemic. For Vermont Public, I'm Nina Kack.
A Warren artist and animator was recently awarded with a Creative Arts Emmy. Haley Morris received an Outstanding Motion Design Emmy for her work on the Amazon MGM docuseries called Octopus, with an exclamation point. The two-part series intertwines handcrafted visuals into the documentary that follows the life cycle of the giant Pacific octopus. The series includes 10 minutes of stop-motion animation directed and constructed by Morris. She says she sourced materials for the segment right here in Vermont.
I love repurposing and finding materials. So I went into the woods with my daughter and found seed pods and moss and stones and different textures, and had the team in New York making the sets incorporate these things from the woods into the rock formations.
And Morris adds she got fabric for the octopus puppet from a store in Williston. This is her first Emmy Award. Coming up, last week, the leader of the state's largest health network resigned amid pressure from regulators and the public to rein in costs. Lola DeFore will give us an update. That's after this.
Thanks for listening to The Frequency, where support comes from SRH Law, believing that values and mission still matter. When you need good counsel for your values-based work, whether it's securing our energy future, building affordable and sustainable communities, or advancing a values-led economy, they're here to help you make a difference. SRHLaw.com. Making a difference is our practice.
The University of Vermont Health Network is facing mounting pressure from the public and regulators to rein in costs. And last week, its leader, Sunny Eapen, resigned. Vermont Public's Lola DeFore tells us what this all means for Vermont's healthcare system. Hi, Lola.
Hey, Mary. Thanks for having me.
Really quickly, Lola, can you just sort of define what the network is?
Yeah, it's the single largest provider of healthcare in Vermont by a mile. It operates the UVM Medical Center in Burlington, our biggest hospital, as well as 2 other hospitals in Vermont and 3 in New York. There are also several clinics and a hospice provider.
And Eapen was there as CEO since, was it 2022?
That's right. And his tenure has really coincided with pretty explosive growth in healthcare costs in Vermont. To be clear, our costs were already really high and on the rise before he assumed his role, but now our insurance premiums are basically the highest in the nation. Predictably, as the public face of the network, he has taken a lot of blame for this problem and been under tremendous pressure to respond to what's universally perceived as a crisis.
How has he navigated this moment?
He's made some really unpopular decisions. He and other network executives took big bonuses last year and in the same period cut some really vital patient-facing services like the inpatient psychiatric unit at the network hospital in Berlin. And at times, Eapen has also adopted a pretty combative posture towards state regulators who have in turn become increasingly willing to take aggressive action against the network and the medical center in Burlington.
Talk more about that. The dynamic was really on display earlier this month.
Yeah, it really was. That's when the Green Mountain Care Board, which approves hospital budgets in Vermont, cut almost $90 million out of the medical center's spending plan for next year. At the same time, Owen Foster, the chair of that board, really took the network to task in a very public way. He said the network had basically created this extractive relationship between Vermont and New York, where profits from the hospital in Burlington are being used to shore up the facilities across the lake. And Foster also railed against what he sees as a very expensive and unnecessary layer of bureaucracy at the network level.
And Lola, is Eapen leaving because of what happened at the Green Mountain Care Board?
It's really hard to peg his departure to one particular moment, but network leaders are explicitly framing his departure as a reset. Tom Galanka, the chair of the Board of Trustees, told me that the healthcare provider understands it needs to do better, particularly when it comes to affordability. And in a statement announcing his departure, Eapen himself said the network, quote, needs to move forward in a different way.
So big changes, but what's next and who's in charge now?
Steve Leffler, the leader of the medical center in Burlington, is going to be taking over on an interim basis at the network starting October 15th. Galanka also signaled that this could mean a shakeup in the relationship between the medical center and the wider network. To know what that will look like, we will just have to wait and see.
Wait and see indeed. That's Vermont Public's Lola DeFore. Thanks so much for catching us up on this news.
You bet. Thanks, Mary.
Thanks for listening to The Frequency today. We had additional reporting from Liam Elder Connors, Michaela Lafrac, Nina Keck, and Adia Golston, who also produced today's episode, with editing by Stephanie Colombini. And our music is by Blue Dot Sessions. I'm Mary Engish. Thanks for listening.